10 surprising signs of vitamin E deficiency you need to know. Vitamin E is a fat-soluble vitamin that can be found in foods such as almonds, eggs, and vegetable oils. It carries many health benefits and can also help to promote cognitive functioning. However, vitamin E deficiency may cause serious health problems. Vitamin E is an essential nutrient that the body has difficulty synthesizing on its own. It is most well known for its role in protecting cells from oxidative damage, but it also plays a crucial role in maintaining a healthy metabolism, providing protection against heart disease and stroke, and aiding in the development of the reproductive system. Vitamin E deficiency can be difficult to identify because symptoms are variable and nonspecific. In this video, we are going to discuss the most common symptoms of this vitamin deficiency. But before we begin, as always, let me remind you that this video is intended solely for educational and informational purposes, and you should always consult your doctor before changing your diet or taking any new foods or supplements. If you like this video, don't forget to give it a thumb up and consider subscribing to our channel to receive future videos with more helpful advice and tips. With that out of the way, let's get started. Number 1. Memory lapses or losses in IQ. It is a well-known fact that we tend to forget things, especially when we are under pressure and disorganized. Yet what's less known is that some people experience memory lapses or loss of IQ due to vitamin E deficiency, which can be caused by several factors such as age, poor diet, alcoholism, and smoking. Vitamin E deficiency can also cause a degenerative disease called Alzheimer's disease. This is a common ailment in the elderly population, and it is often observed that a person with a vitamin E deficiency has a higher incidence of memory loss. This is because the vitamin plays an important role in protecting the brain from oxidative stress and inflammation. In 2008, it was observed that people who consumed foods rich in vitamin E had an increased IQ when compared to those who did not consume these foods. Number 2. Numbness or tingling sensation in hands and feet. Numbness or tingling sensation in hands and feet due to vitamin E deficiency is a common health issue. Have you ever experienced a numbness or tingling sensation in your palm, toes, fingers, arms, or legs? If yes, then it's time to check your vitamin E levels. One of the reasons for this condition could be taking antibiotics, which can reduce the absorption of vitamin E from foods. In addition to that, regular intake of alcohol and tobacco products also reduces the absorption of vitamin E. Number 3. Dryness of skin and rashes. Vitamin E is an important vitamin that keeps the skin moist and hydrated. This vitamin is found in plants, especially green vegetables, seeds, nuts, and oils. Vitamin E deficiency can cause the skin to appear dry, rough, stiff, and cracked. If left untreated, it could lead to more severe complications, such as eczema or psoriasis. The main causes of vitamin E deficiency are malnutrition or malabsorption of fat-soluble vitamins due to intestinal diseases, such as Crohn's disease or cystic fibrosis. Number 4. Premature aging. The symptoms of premature aging are the development of wrinkles on foreheads, sagging muscles, or muscles with thin limbs. The person may also have dry skin or hair without shine. It can be found in people with chronic diseases, malnutrition, alcoholics, and those who do not consume enough vitamin E. Vitamin E has antioxidant properties which fight the free radicals. Free radicals are usually produced during metabolism and lead to cell damage. There are various ways in which this deficiency can arise, such as poor dietary habits, infections, smoking, environmental pollutants, and sun exposure. Premature aging can also result from various genetic mutations, that lead to an inability of cells to produce the right amount of vitamin E or transport it into the cell nucleus. This phenomenon is called familial ataxia and occurs due to a mutation in a gene called ALD7A1. Number 5. Infertility in women. The problem of infertility is a widespread one. Infertility in women can be a result of various factors such as hormones problems, uterine conditions, and other medical issues which have been addressed by specialists. However, there is another cause that may have been affecting fertility for many years and has only recently been studied in depth: vitamin E deficiency. It has been found that the lack of this essential vitamin can lead to problems with ovulation and implantation, leading to infertility. One study found that around 30% of infertile women were deficient in vitamin E. Women should adopt healthy eating habits or take supplements derived from natural sources if they want to increase their chances of conceiving a child without the help of medical interventions. Number 6. Carpal tunnel syndrome. Carpal tunnel syndrome is the most common type of work-related hand and wrist disorder. It is caused by a pinching of the median nerve, which is located in the carpal tunnel that is formed by 8 small bones in your wrist. There are 2 types of carpal tunnel syndrome: occupation-related carpal tunnel syndrome, which happens due to jobs requiring intensive use of hands and wrists for prolonged periods. Idiopathic carpal tunnel syndrome, which is most often found in people who are using their wrists or hands intensively for years without breaks or periods where they don't do anything with their hands. A vitamin E deficiency can lead to carpal tunnel syndrome because vitamin E helps to keep the linings of blood vessels healthy. If you're deficient, your body might not be able to form a thick enough lining to protect the blood vessels, so they become inflamed and may swell. Number 7. Increased risk for stroke or heart disease. The term vitamin E is often used interchangeably with alpha-tocopherol, a natural form of the vitamin. Alpha-tocopherol is a type of lipid or fat that can be found in some foods and in the human body. It has been studied extensively, and it has been linked to a lower risk of stroke and heart disease. A study published in the Journal of the American Heart Association showed that people who took vitamin E supplements for 4 years had a 4 to 4% lower risk of stroke or heart disease. 89 participants were randomly assigned to take 400 international units, IU, of vitamin E per day or a placebo pill for 4 years. The study found that those who took the vitamin E supplement had 4 to 4% lower odds of having a stroke or developing heart disease than those who did not take it. Number 8. Anxiety and depression. Depression and anxiety are the most common mental health disorders in North America, accounting for up to 1/3 of all hospitalizations. While there are many causes of depression and anxiety, a potential link with vitamin E deficiency has been proposed due to its role as an antioxidant that could protect cells from cellular damage. Studies have shown that low levels of vitamin E may lead to increased anxiety and depression by negatively impacting your mood and serotonin levels. A recent study from Harvard University found that dietary intake of vitamin E can help reduce anxiety and depression symptoms in people with low levels of vitamin E. In the study, researchers found that those who took 400 IU of vitamin E for 8 weeks reported a significant decrease in their anxiety and depression symptoms compared to those who took a placebo pill. Number 9. Muscle weakness. Vitamin E deficiency can lead to muscle weakness, especially in the limbs and other body parts that are used extensively. Deficiency can be caused by a diet that does not include enough vitamin E or because of problems with the intestines and liver, which could interfere with the absorption of vitamin E. Vitamin E deficiency can also be due to an underlying health condition, such as Crohn's disease or cystic fibrosis. In order to prevent muscle weakness from being an issue in your life, it is important that you have a diet rich in this nutrient. Number 10. A weakened immune system. Your immune system is one of the key parts of your body that protects you from various diseases and infections. Unfortunately, a weakened immune system can significantly lower your chances of beating a virus or getting better from a bacterial infection. Do you know that vitamin E is essential for the immune system to function properly? That's because it helps fight inflammation and plays a role in transporting some of the white blood cells to areas of infection. There are many factors that can contribute to a weakened immune system, such as stress, poor diet, and even the weather. Vitamin E deficiency is one of the most common contributing factors. It is difficult to tell if you have a deficiency just by the symptoms alone, as the symptoms are also associated with many other health problems. In order to be sure that you have a deficiency, you should have your blood tested for vitamin E levels. I hope you enjoyed the video, and if you'd want to help us produce more like it, please subscribe to the channel and turn on the bell to get any future videos with more useful health-related tips and information.